Welcome to another podcast powered by OMNI Layne Counseling. I have Richard and Amelie joining me here today. How are you folks doing?
Oh, we're doing great. Hello, Texas. We're here for you.
That's brilliant. Let's unpack a very important topic, and that's trauma. Would you define for me what trauma is?
That's a very interesting question, Sherman. I looked up 5 dictionary definitions of trauma. All 5 of them had some differences and some similarities. Today, we have 2 types of trauma according to the dictionary. We have physical trauma and we have psychological trauma. And some of the differences were like one dictionary said severe psychological trauma or severe psychological insult led to the trauma. That's not necessarily true. Being insulted can actually lead to trauma or being traumatized. This has created a problem with their clients that are coming in with social media and with YouTube in particular. People are hearing all these different things. Everybody's now confused about what the term trauma is. Putting it in a very simple way is this: trauma is any insult or injury. Bottom line, that's what trauma is. When we start moving beyond that, we're getting into complexities, which we're sure going to talk about in just a moment in this particular podcast. With the definition being very confusing, remember we talked about labeling last time. Labeling can play into it here and be very confusing for people also. When you hear about trauma, you hear about trauma victims. I don't like the term trauma victims. They're trauma survivors. Being a trauma survivor, then you can move on. You can do different things. You can actually get well once again. Because PTSD, which is what much people associate now with trauma, is actually very treatable. A lot of people hear it's not, and that's unfortunate. But my lifetime experience, both personally and as a counselor, has shown me it's very treatable disorder. What do you think, Amelie?
I definitely agree. There's a good children's book that describes trauma to kids, and it's called A Bad Thing Happened. And trauma is a bad thing. The definition of trauma, think of it as a spectrum. It's not necessarily abuse or something assaultive. People that have lost people, think of men, women, horses that have lost colleagues. I think of people that have lost many family members, have been in a disaster. It's not necessarily like it happened directly. And that's another trauma. There's also secondary. And the biggest example I always give is 9/11. People that were physically in New York, 100% that was primary trauma directly happening in front of them, but the rest of the country was watching. The Twin Towers collapsing, watching planes coming down from the sky. It was scary in the first grade, but my parents talking about it, they were terrified. They were like, what is going to happen? And as a military brat, my dad's in the service. And so that was also, I think with trauma, it doesn't only affect the person, it affects everyone else. And I agree, Richard, the term
Yes.
is 100% you're going to get this. You're going to see the other side. They use the term survivor for cancer patients. They use cancer survivor because the odds did everything to get to the other side. And that's the thing with any type of disorder, any type of thing that brings you to therapy, as long as you're wanting it, you can get to the other side. It's very hard, but you can definitely.
I want to go back to this term survivor for just a second and secondary trauma. I wanted everybody to know I'm a trauma survivor, very serious trauma, actually. And I got through it. Through counseling really helped a lot. 2 years and a lot more work after that. I've been working myself for over 30 years at this point in my life. My life has gotten much better. So you can definitely move forward as a survivor. If you look yourself as a victim, you're going to be trapped as a victim. Now, for secondary, I want to give everybody a life example of my own, 9/11. I will never forget the day 9/11 happened. I was at home and I wasn't even watching television. And my girlfriend and wife now, Diane, called me. She said, "Hey, have you seen the news? What's going on?" I said, "No, let me turn the TV on." And 9/11 was unfolding right before my eyes. And I will never forget the news media replaying and replaying the airplane going into the building. And I was sitting here going, "Oh, I just can't take this anymore." I was getting re traumatized watching that. And I eventually turned it off.
Hmm.
Secondary trauma is very real. Secondary trauma can happen to everyone around you, not just your wife, etc.
The professionals in our career field, field journalists, everyone that's saying secondhand, and even reading about it,
That's right.
watching it. We're human. It's going to affect us.
And this is actually blowing my mind and really expanding my perspective or realm of what trauma is. When Richard mentioned that it's any incident or injury, that's very all encompassing. And
Yes.
so there must be different levels or complexity of trauma. I know you talked about primary and secondary trauma, but there must be different complexities or levels. I'm wondering if you guys can expand on that.
There's also complex trauma. I used to work with foster care system. And
Hmm.
for a lot of them, I don't like to use this phrase, but they were getting re-traumatized. All the terms that you hear
Correct.
in the foster care systems, the S world, these kids would go to foster homes, adoptive homes, or back to home. And instead of it being a safe place, the being, and they got re-traumatized or experienced the same type of trauma, they experienced the reason why they got removed or something brand new. And I also think of soldiers out there going for another tour is the same. Not everything they're going to mistakes. And even in our profession, even though we've heard it all, there is going to be still one thing that we heard. And I always tell my clients, this surprised me, judge you. The only thing, I'm human, so I'm going to be concerned. I have to have some type of reaction, but it can't be all about me. The only way I feel like I really can show empathy is by showing them like, oh my goodness, that should never have happened to you. So complex trauma is one trauma after the, and it doesn't have to be simultaneously. It could be spaced out over time. Survivors can do the work, therapy, but then something happens and it brings them back to those behaviors and those triggers that, or flashbacks even, that feel like they're starting all over, but it is a different trauma that's being already
Hmm.
Talk about levels of trauma. This happens occasionally also. Let's say you and I, Sherman, are standing side by side. And let's say a plane crashes right in front of us.
Hmm.
For some people, you might have one person over here going, what am I going to do? Okay. And the other person goes, no big deal.
Hmm.
Trauma affects everyone differently, especially at first. And one of the most common things is that you can go through a quote unquote traumatic experience and not experience any symptoms of PTSD for 6 months to a year. And sometimes later, it just hits you.
Wow.
And suddenly,
Is it because of how amazingly we're wired, our brains protecting us from that
yes,
moment until the incident's way past and then relaxes and then you see the impact of it?
it has a whole lot to do with our biology and our cultural upbringing and our social upbringing, etc.
Mm.
But it also has to do with the way the amygdala functions in the brain. And we're not going to get into that right now,
Hmm.
but the amygdala is very important for these types of reactions. And everybody's functions differently.
Hmm.
Amy's job. Traumatic happens. She's in charge. I like what you said, Richard. There's all these different things make us, which is cultural, society, our biology. At the end of the day, based on those things, that's how we're going to respond. Culturally, we're taught to not feelings.
Mhm.
You're going to bubble it up. Of course, you're not in a box. You could respond whether or not you share your emotions. If a plane crashed, someone's going to respond and others are going to be in shock.
Mm.
Students are just going to sleep, the fight, flight, or freeze.
You brought up something that triggered a thought, Amelie. I always believe that our modeling is our default mode. And so I can't help but think of the children growing up in families where they are highly discouraged from showing emotion. Like you just mentioned, bottle, man don't cry, that kind of stuff. And if Richard says that trauma is every incident or injury, and what I thought about modeling, there must be with children, young children, it must impact them totally differently than it does older children or adults. How is that with young children?
It's weird because one thing at home and then at school, they're also taught another thing. Are really pushing for mental health awareness.
Mm-hmm.
Counselors, they'll even recommend this kid can't come until they seek professional help. It's very hard to show my emotions, not. It's this internal battle of what do I do?
Mm-hmm.
My parents are saying one thing, but then my teachers, my classmates, and the rest of society is expecting another.
Mm-hmm.
And so I think it's always going to be a cultural clash. Education about emotions are not bad.
Mm-hmm.
Anger, jealousy, they're natural. Like how we were talking about anxiety and depression a couple of
Yeah.
they are so natural. We would not have survived without
Mm-hmm.
them. It's the caveman days. If they didn't have anger, they wouldn't have cared if their friend got ill. Those emotions matter. It's finding a way to show them in a way that is acceptable on both. If we're angry, we use our words. Take a break. It doesn't have to necessarily be bottled up, but it could be how we show it without showing it. It's meeting in the middle with a compromise. Okay, this kid needs to show something.
Mm.
And how are you supposed to know what they need unless they tell you? Can we use our words to show emotion instead of physically on our face? Or can you at least take a step out? I tell kids, can you take a step out of the classroom or take a step into your room? Do what you need to do to calm down and rejoin once you're ready. It can be a lot of learning how to create their own safety and their own coping skills in terms of how do I show my emotion and not get in trouble at the same time. I think it's always going to be an ongoing battle for a long time. Certain family members didn't really believe in my profession. Depression wasn't a thing. And so that's also hard to hear as a kid.
Yeah. Yeah.
As long as we're continuing to say, hey, your feelings are valid and natural.
Mm-hmm.
I'm sorry that not everyone is going to agree with that, but how do we show them in a way that's good for you? And that's the true nature of a compromise. It's something that you're happy with and they're happy with. So
Mm-hmm.
sometimes you're not going to get all of it, but I think for these kids, can we get at least 50%?
Mm-hmm. Richard, you were mentioning earlier about how you define trauma. Has the definition of trauma changed over the years?
It has. I'm very much into etymology, which is the study of words and word origin. All my adult life, I've loved it. So I've looked up different definitions over the years. These psychological definitions I'm seeing in the dictionaries now are very new. They didn't used to be there at all. Trauma meant an insult or an injury of some kind. And another major influence, there are tons of trauma videos out there now.
Mm.
There's something called complex PTSD now,
Okay.
which is not even in our book.
Okay.
Someone has named it. We have trauma. We have narcissistic trauma. We have borderline trauma. There are thousands of them at least.
Mm.
And people watch these. They will watch a bunch of them. And some of the people who were doing these videos are professionals and some aren't. So they get differing information. They get lots of different definitions of what's going on out there. And then we'll hear a person's perspective and they think that's the only perspective. But then if you listen to the next person, of course, you're getting a totally different perspective. Yes, there's a lot of confusion going on about it right now. And unfortunately, the American Psychological Association is not really helping, because the definition of trauma that is in our DSM-5 TR now, I think it needs some, I really do. They say there's a difference between children 6 years and younger. The definition for PTSD and or over 6 years, well, when you look at it, you don't really see it. So we need lots and lots of work. But please remember, the definitions of trauma and PTSD are very new right now. Okay? Remember, before the DSM-5 came out, that the definitions of trauma and PTSD were, it was a soldier's problem. Vietnam veterans, that's their problem.
Mm-hmm.
That's poor little kid that was beat up in the corner. That child that was tied up and put into the closet for a week. So things are changing quite a bit, but we definitely need some work on this.
Talking about working on it, there must be different modalities or types of treatment in working with children and adults. Am I right about that?
For kids specifically, a lot of professionals will do play therapy.
Mm.
It's a great way for the kids to express themselves. There are also within the play therapy realm, sand trays. We learn a lot about by they're playing with the sand. Are they smashing it or
Right.
just letting it run freely? Even with toys, a lot of investigators will use toys to figure out, hey, what can you show me on this doll? Can you draw me a picture? I know with art, for a lot of kids, they'll draw me pictures of what's going on. Can you show me what happened? Or can
Mhm.
you tell us? Even with families, who is in your family? Draw the family members. Ask questions. Being curious. Okay, what does this mean? What does that mean? So with play therapy, you can go in action. Sometimes I do a little bit of narrative. I ask them a story based on what we're playing with, or just based on either life or on fairy tale. Sometimes their reality is seeping into their play or their
Right.
pretend. Definitely play therapy.
Richard, well, the adults, any modalities that are commonly worked with?
Yes, in general, most therapists use cognitive behavioral therapy for treating trauma. However, unfortunately, cognitive behavioral therapy has some limitations. And one of the limitations is it does not tend to focus on emotions and feelings very much at all. It also tends to be very time limited. A lot of therapists will say, "Oh, 18 sessions, we're done, you're cured." That's not true, of course.
Mm.
So CPT is a big one. And it can be helpful, but I find that CPT works best with neuroscience counseling, the study of the brain, and cognitive reframing. And for people to understand, anxiety in particular comes from two different primary sources, which we're really not going to get into right now. But those take different approaches. Not only that, with cognitive reframing, one of the things I explain to people very often is you're going to do the cognitive reframing, but the very first time, though, it may not work. It can take time. And I tell everybody, some things, very short amount of time, you're going to be done. You're walking the street, I'm done. Okay. And then other times it's going to be like, what? Is it ever going to be through? This is a very important point to remember. Very important, because people can do things differently. Their traumas can be different. They can react differently. Your brain can also react differently to different traumas.
Mm.
So one thing for you could be very profound to deep and take that extreme amount of time to get over. And some of you definitely another thing, I'm like, no big deal. And they're pretty much over it. There's also potentially exposure therapy. Exposure therapy is used mostly with the military, quite frankly, these days. However, you can use it in counseling. It takes a lot of setup and a lot of practice and a lot of procedure with trauma survivors. It can be very effective for some and not so effective for others.
Hmm.
Also, You can use dialectical behavior therapy with trauma survivors because part of dialectical behavior therapy is putting structure and using mindfulness to help impart that structure, to help the person relax and go, okay, it's not that bad. I'm really not dying. I promise.
Mhm.
Mindfulness is very effective for all counseling clients, quite frankly. Some people just talk therapy,
Mhm.
just coming in and talking about things. We can do all of this other stuff. And they're looking at me going, oh, I just want to talk about things. I have that happen occasionally as well.
Sometimes just talking about it, getting someone to give some feedback or just to listen. Sometimes it's, I need to word vomit on you. I just need to let it out. And other times it's, I need you to actually say something back to me.
Okay.
So
Right.
sometimes I'll even tell kids and parents, I was like, when they're telling you something, asking at the beginning, hey, before we sit down and talk, do you want me to listen to you or do you want me to give feedback so that I'm listening? Because it's the difference between passive listening and active listening.
Mhm.
Hey, I hear you. Like, wow, that sounds very difficult. What are you going to do about it? And asking questions as we go. But others are just like, I just need to tell you about my day and then I'll be good.
Husbands too,
Yeah.
Yeah.
as they communicate with their wives.
Oh my gosh, there's a great video to explain that. Modern Family, there was a fight between Phil Dunphy and his wife,
Uh-huh.
and he was trying to solve her problem. All she wanted was for him to listen.
Listen,
Right.
He was at a spa, and the women were like, what are you doing? She just wanted you to listen to her. You didn't want to solve her problems. When we were talking about trauma, how for some people it works and for others doesn't like really work for me. Same thing for the responses. Sometimes a car accident really affects someone's ability to drive again. And
Okay.
others, I just get back in my car and drive.
It definitely does sound
right.
nuanced. It does sound complex and very layered. And there can be a lot of improvements, as you said, Richard, with DSM and navigating the different layers of it. As we wrap up today's episode, Richard, do you have any final words to viewers with regards to trauma?
Yes. Just because you have a trauma does not mean you have a mental health disorder.
Mm.
It does not necessarily mean you have a huge stress disorder. It does mean PTSD or even adjustment disorder. You've been exposed to a trauma. That's what it really means
Mm.
at that point. We do a very thorough assessment here for trauma.
Mm.
We look for anxiety in relation to the trauma, depression in relation to the trauma, dissociations in relation to the trauma, flashbacks. All of that is a part of our diagnosis that we do for the clients when they come in. Okay. And if you don't fall into those categories, then guess what? You probably don't have PTSD.
Mhm.
Okay. I hear people come in all the time. And this is a little bit off subject, but it's a great example. I'm OCD. What do you mean you're OCD? It's like that thing's my way. Okay. Is that all? Well, yeah. Then you're probably not OCD. Or you probably don't even have OCD. Okay. It's just you're a type A personality. That's a different issue. But we hear this all the time out there. And that's part of this confusion we can go back to this being created by books, that's being created by YouTube, social media, your brother, your sister, whatever. It's all out there. So here's the main thing. If you think you have a mental health problem, go to a counselor, go to a psychologist. Come here, please. Make the appointments out of OMNI Layne Counseling,
Mhm.
and we will do our best to diagnose you properly when you're here. But please remember, when you come in, be honest with your counselor. Tell your counselor everything that's going on. If we don't hear it, sometimes we don't see it. It depends.
Because you can't read minds.
Correct.
Any final words to viewers about trauma?
Yeah, I definitely 100% agree with Richard. Like going back to labels, you are not your trauma. Your trauma is just a little piece of you that happened to you. And it does not mean you're crazy or that now You have to have a new label of a mental disorder. We're human. We're not supposed to be perfectly fine after a trauma. That's too much to ask of you. And so definitely reach out, even if it's not to a professional, at least to a family member, a friend, so that sometimes you feel like you need to be alone, but that is the best time to not be alone. Even if it's not that severe, maybe it's best to get a second opinion so that a friend or family can be like, "I think you're okay. I think you need to talk to someone."
Right.
I think it's best to still continue to talk to friends and family, but come see us. Come see a counselor in another practice. I would hope that you'd come see us, but I think at the end of the day, people are here for you. We are definitely here for you. So take advantage of it. Be
Hmm.
honest, be vulnerable. I know it's really hard, but sometimes it's better to get it off your chest than to keep it bottled up.
That's great. Thank you, Richard and Amely. We covered a lot of ground today about trauma. We unpacked the definition,
Yeah.
different complexities of it, modalities, influence. And I love the compassion of what you shared with our viewers at the end here with your final words. So for those viewing, those listening, amazing topic of trauma today. Thank you for joining us. Stay tuned next week with OMNI Layne Counseling.